evening. I'm Erin Burnett. Out front tonight, the breaking news on the first Ebola diagnosis in America. Many developments to talk about tonight, but perhaps most disturbing this. New details about how a Texas hospital's mistakes exposed the public to the deadly virus. The patient, identified late today as the man you see here, Thomas Eric Duncan, is a 42-year-old man from Liberia. He went to Texas Health Presbyterian Hospital on Thursday. A feverish Duncan told hospital workers he had just arrived from West Africa, the center of the Ebola outbreak. But somehow, doctors gave him an antibiotic, some pain reliever, and sent him home. That crucial decision exposed the public, including school children, to Ebola for about 3 days. And then, for 72 hours, Duncan, he's not in isolation. He's not even in a hospital. He is out, walking around. When he finally returned to the hospital on Sunday, he told the staff again that he had just arrived from Liberia. He was feverish. He was vomiting. It was only then that they finally admitted him. Duncan was diagnosed yesterday with Ebola, 5 days after he first went to the hospital. Let's say that again. 5 days after he first went to the hospital. He's now listed in serious condition. As you can imagine, how this case has been handled is fueling outrage tonight, and we start our coverage with our senior medical correspondent, Elizabeth Cohen. She is outside the hospital in Dallas. And Elizabeth, the question I have is, how could this have happened?
You know what, Erin? Unfortunately, miscommunications happen at hospitals with a great deal of frequency, but seldom does it have this kind of potentially devastating consequences. The family of 42-year-old Ebola patient Thomas Eric Duncan says he's in pain and hasn't eaten for a week, now in serious condition at Texas Health Presbyterian Hospital. Now, health authorities are closely monitoring between 12 to 18 people, including 5 children. They all had contact with Duncan on this, his first trip from Liberia to the United States. Authorities want to make sure they, too, don't develop the signs of Ebola.
The public can be assured you're going to be safe. This virus is isolated, is being contained, will be contained.
But there are safety questions here in Dallas and in the United States. Duncan arrived in the U.S. from Liberia on September 20th. 5 days later, he went to the hospital for care, but was sent home. And officials saying that in response to a nurse's question, Duncan volunteered he traveled from Africa.
That nurse was part of a care team, and it was a complex care team taking care of him in the emergency department. Regretfully, that information was not fully communicated throughout the full team. And as a result, the full import of that information wasn't factored into the clinical decision-making.
2 days later, Duncan returned to Texas Health Presbyterian Hospital. A close friend tells CNN the hospital wasn't moving fast enough, so the friend called the CDC. The CDC directed them to the Texas Department of Health, leading to a phone call to Presbyterian Hospital. Duncan was then isolated, and after tests, it was confirmed he had Ebola. We're told Duncan has called family and friends from the hospital, prayed with them on the phone, and cried. While there are questions about the hospital's handling, there are also concerns about screening at U.S. airports. We have our feet sprayed. I came back from Liberia just 4 days ago with 2 colleagues. At the airport, we told immigration officials we'd been covering Ebola. No one took our temperature or asked if we'd been near patients. Only I was told to monitor my health for 21 days, but no one told me what to look for. Back in Dallas, the children, relatives of the patient, have been advised to stay at home.
We have custodians, of course, cleaning the buildings every day, but we're going to add custodial staff to those buildings. It's not a hardy virus, and so regular disinfectants is going to help.
Health officials say everyone who had contact with Duncan is feeling fine and are not in quarantine.
People cannot transmit this disease until they have symptoms. Okay? And so individuals that do not have symptoms are not going to transmit this disease to individuals. The chance of them transmitting it is 0.
Health officials say even with this first case of Ebola diagnosed in America, the U.S. will never get to be anything like West Africa, where poverty and a weak health system have led to chaos and misery. Now, as I mentioned, this kind of miscommunication, like what happened at this hospital here, this is sadly not an unusual event. There are experts who've written entire books about miscommunication at hospitals. Hopefully this event will be a very clear call that something needs to be done. Erin?
All right, thank you very much, Elizabeth. And certainly something that can fuel shock and outrage when you consider Texas is supposed to be one of the 13 states in the United States that was supposed to be completely ready for this to happen. The New York Times tonight is reporting something very important. They are saying that Duncan had direct contact with a pregnant woman who had Ebola just 4 days before he left Liberia for the United States. The New York Times reports that Duncan helped the sick woman get to the hospital by taxi. She was convulsing, yet she was turned away at that hospital because there weren't enough beds. She died hours later. The New York Times also reports that others who have come into contact with her are now sick or dead. Another potentially huge